Around a quarter of all households in Nottinghamshire own pets. In this programme, we visit a local vet to find out about the people who work there and care for the animals. That's a day in the life of Oak House Veterinary Centre.
I pull up in the morning quite excited, not quite knowing what's going to go on, which I quite like. Hi Jen, how you doing? Morning. I love talking to people and communicating with people, and I like animals, so I have a perfect job.
Oak House Veterinary Centre was opened on Plains Road, Mapley at the start of 2014 by Andrew Draper and his team.
And when we first come in, we'll normally set up for the day's operations. We'll get all the inpatients in, we'll do all the admits, get all the pre-meds sorted and wait for the vet to get in to check the animals before we do the operations. And then after, it's just basically cleaning, monitoring the patients and then sending them home.
Little Ruby is 6 months. All right.
The first consultation of the day is with 6-week-old Cavalier King Charles Spaniel, Ruby.
Ruby's a little Cavalier King Charles Spaniel, a very sweet little dog. She was in for having her neutering operation, so she was having an ovarohysterectomy, or a spay as it's called, and she had an admission appointment with the nurse, and she had a check over and the consent forms were signed. We have the estimate that they go through to make sure they're happy with the pricing, and then she was brought through into the kennel, and then half an hour before she's due to be anaesthetised, we give her a pre-med, which is a mixture of sedative and pain relief, and that makes her go nice and sleepy.
A pre-med is to make the animal more relaxed and calm before the anaesthetic is given. It's a sedation, and we give it to them so that their recovery is a lot faster.
Next up is Alfie the rabbit and Jim the cat, here for an immunisation jab and check-up.
Alfie and Jim, please. You bring them both through, it'll be okay. Yeah.
I'll give you that one then.
Great, thank you. This is Alfie, is it?
That's Alfie, it is.
Alfie's here for his booster and check over today.
He is, yes.
There we go. That's a good boy. There we go. We've got some little scales here that are ideal just to check his weight up. And he's eating and drinking nicely, is he?
Yes, yes, he eats plenty.
It's really important with dogs, cats and with rabbits that we give them regular health checks, and we make that part of our annual vaccination boosters as well. That looks good. And he has plenty of roughage, does he, to eat?
He does. He has a constant supply of hay.
These days we can treat and investigate rabbits to the same degree as you can a dog or a cat, and definitely quite a lot of our clients have house rabbits who are vaccinated, they're neutered, they're kept with special diets, and they expect the very best of healthcare. I really enjoyed I've done quite a lot in my sort of experience, done quite a lot of rabbit and small animal work. So we're going to give him his vaccination now. So this is I don't know if you've had it before, this is the new jab, that's the single injection.
Yes, that's what he had last time.
For this, just for the myxomatosis and the hemorrhagic viral disease, and it lasts for the 12 months. So.
Yeah, that's fine. He seems fairly healthy.
Good. Okay, we'll have a look at number 2.
Okay.
This is Jim.
This is Jim, yes.
Is he showing signs of slowing down or ageing?
He is slowing down a lot. He sleeps a lot now.
Yeah.
He's happy just to lie on his cushion and watch the world go by now.
With the cats, we're vaccinating mainly for 3 main groups: the cat flu complex of viruses, the feline enteritis, which often causes sudden death, again a bit like the HVD in rabbits, can be really quite horrible, and also the feline leukemia virus, which is the AIDS-like viruses that cats can pick up. Yeah, well done him, he's good. Excellent. Have you got your vaccine cards at all?
I have.
Let me fill those in. Yeah, lovely. Okay. Great to see them. Well, they're both beautiful, aren't they? They've both been very good patients today.
Thank you.
Okay.
Okay.
Let's just go through. The bit I personally enjoy is what we touched on before. I think our relationship with our clients. I think it's a great responsibility and honour that people put their trust in you to look after their animals, and some of our clients, lots of people with their pets, have such a close bond. It's a very great, it's a great responsibility, but it's also a great pleasure to be able to help them out.
In consultation room 3, Benson the cat has come in for a dental procedure.
How's he doing?
Not happy.
Not happy? You reckon he knows?
Yeah, I think so.
Hey, little man.
But he's okay, yeah.
So he's in for his dental. You do realise that there's possible extractions as well.
Yeah, absolutely.
So you have been made aware.
Yeah.
He's going under general anaesthetic, so you do realise that there's always a slight risk of something going wrong, even in a healthy animal. But we do want to assure you that he'll never be left alone. There'll always be someone with him, be it during the procedure or after in recovery. There's always a nurse present to monitor his situation, so as to minimise the risk, just so you're a bit more comfortable and not too worried.
Thanks very much.
Okay, no problem. Bye.
Let Benson.
He's having a dental with possible teeth extraction.
Out in reception, the owner of regular patients, Emma and Theo, has come in to find out their results.
I was actually diagnosed with stomach cancer 10 years ago, and I had wanted a dog for quite some time, but I was working full time and I knew I couldn't get a puppy while I was working, and both my sons said, look, you're going to be off work 6 months, Mum, why not I get your puppy now? And I got Emma then.
So Emma's a very special dog. She's been very active in her youth, hasn't she? She did a lot of agility work and training, but unfortunately she's developed a bit more arthritis as she's got older. She's 10 and a half now, so it's perfectly entitled to have a bit. And we're basically treating her with a combination of acupuncture, and we're also giving her an injection of a special anti-arthritis drug.
I had a lovely, lovely lifetime with Emma. We've done agility, we've done hill work to music, she's done obedience classes. We have a little go at everything, Emma and I, but unfortunately Emma had to retire from agility 2 years ago because of her arthritis.
Hopefully we're trying to keep her nice and fit without having to over-medicate her at this stage.
She's not had any Metacam for over a year.
Yeah, which is great, isn't
really
it?
Fantastic.
Yeah.
I've been retired 3 years ago, no, 4 years now, and decided that time was to have another puppy, and that was when I got Theo. He was 8 weeks old when I got him, and life's just been wonderful with them both. I just spend every minute doing things with my dogs, just absolutely love them both. They are my life, bless them.
Good, nice colour. Has he had a cough at all post-operative?
No, not at all.
Sometimes you get a bit of a cough after the operating, because we know we put the tube down the throat for the anaesthetic, so sometimes they have a little bit of laryngitis.
Beginning of February, we went for a lovely walk Monday morning, absolutely fine, charging around like crazy. Suddenly, middle of the afternoon, he just flopped. He just got no energy, he could hardly get off the bed. We got him up to the vets and they gave him an injection, and I brought him home, and the following day he just flopped, and I had to take him back, and they hospitalised him. He was on a drip for 2 days. Can I start taking him for walks? Laura said just walk him for toileting, but he really does need...
I think steady leash exercise is fine.
Yeah.
You're probably best
Not
to avoid...
off his lead.
No, I think keep on his lead.
They were very pleased with the results of the x-ray, because we knew he would have slight scarring in his lungs from the pneumonia, but that was so mild. They were very, very pleased with that. His blood test came back with a high white cell count, but Cavaliers do have a high white cell count, so it wasn't unduly high. And he got over that, we got him over that fine. I've got no concerns about him at all. He's, so once he can keep that collar off, I know he's going to be absolutely fine. During his examinations with that, it was discovered he had, for a little dog, he had got quite a large prostate, and we decided that now was the time for castration. And from the x-rays, ultrasounds and everything. Unfortunately, it's shown this something on the x-ray in the bladder, and now we've just got to wait for this second result, and I'm just hoping against all hope that there's nothing serious there.
Yes, so on the X-ray there was that area of like opacity, wasn't there, that was just above.
On the top of the bladder.
Yeah, this
Yes.
is what they call the sublumbar area, which can just be fat or tissue. I suppose what we were slightly worried about was whether that could be lymph node. That is potentially of concern.
Right.
So need
Concern as to
possibly
what could that be?
there could be a tumour there.
I'm just hanging on to every hope that if life gives this little boy cancer at 3, then there can't be anything more unfair than that. I'm sorry. Surely they can't do that to him. That would be so unfair. But whatever it is, we'll deal with it.
I think, as I say, we need to wait for the second part of the cytology to come back yet, which I think will be done today or tomorrow, so I'll get that chased up.
Okay.
And obviously we'll take advice from there with this as well.
Right. So. And I've got terrific faith in what they'll do. That I have got no qualms whatsoever. We are with the best vet we could possibly be with.
All of us empathise and feel as pet owners with what's going on, but like you say, you have to be able to separate that from your clinical part of your job and your kind of professional sort of duties. But I think it would be a very poor vet or a poor nurse who didn't have those emotional feelings as well.
Coming up after the break, a Great Dane with blue nail polish, and Andrew begins surgery. Plains Road Surgery is the third veterinary centre that Andrew has opened in Nottingham. Since the practice first started in 2004, he has built up a loyal following amongst his many clients.
I think one of the nice things here is it's not just one approach. I think we all clinically work very similarly, but our approach to communication and talking to clients is all slightly different. So some people like to see me, some people like to see Anne or Laura or Sarah or Rachel, and I think that's again a strength of the practice, that we're not just kind of one person you see all the time. Same goes with our nurses and our receptionists. Yeah, I think it's the strength of the place is our overall teamwork, but that doesn't mean you're all clones of each other.
Whilst Andrew scrubs up, Hope gets Ruby ready to be spayed. Andrew administers the anaesthetic and Ruby's fur is shaved in preparation for her surgery.
Hello, Accounts Veterinary Centre, Plains Road. Jennifer speaking. How can I help you? Hi, my name is Jennifer Green and I'm the receptionist at Accounts Vets. Lovely. And your surname? I was coming as a client and I was here quite regularly, and they mentioned while I was waiting that they were looking for a receptionist at the time, and I'd worked in a dentist previously, so I'd sort of done reception work, so I sent my CV in and got an interview, and then I've been working here since. You know, obviously the sad side of the job, which I don't know if I'll ever get used to, is obviously when you've been treating an animal and you get to know the owners, and then obviously we lose the animal. That's very sad when you've got that attachment to both the animal and the owners. But on the other side, yes, we've had some very sick animals and they go home well again, and the owners are very happy and very grateful.
I think the first week that Andrew had started after he'd bought the practice, I came in to see him, and I knew from the very first time I saw him that he was my kind of vet. You can talk to him, he's not rushing out of the door when your 10 minutes are up. I think the main thing for me is the fact that it's the relationship I've got with Andrew, the other vets, the receptionists, the nurses. Just trust them so much.
The operation has started and everything is going to plan.
We use quite modern anaesthetics these days, which is lovely that the dogs and cats and rabbits recover very quickly once you turn the anaesthetic machine off. They wake up within minutes. There isn't the hangover we used to have in the old days with some of the older anaesthetics we used to use. So once we're happy she's starting to come around nicely, she's put back into her kennel, and then we have a kennel nurse whose dedicated job it is to monitor the recovering patients.
Well, normally on the admits, I normally say I'll give them a call about lunchtime just to let them know how their animal's doing and just to reassure them really. And then we give them a call straight after the anaesthetic just to let them know that their animal's doing okay.
Back in surgery, Andrew is getting Benson ready for his dental operation. In the dog ward, Ruby is recovering well.
The temperature is low, it's picked up now at 37.7. Ideally we want to get it around 38, 39. Let's try some more food to see if she eats it. I don't think she's going to eat anything though. What's this? What's this eat anything, do you? Hopefully she'll go for it, I don't think she will though.
I think the great thing, all our staff are pet owners of some degree or other, and I think we all know what it's like to have a poorly pet or be concerned about an animal, so we kind of use that as our guide as to what we would do for our clients' animals.
In reception, the 4-month-old Great Dane, Penny, is in for a checkup after being ill.
Penny Sutton, please.
That's you.
Hiya. Hello, Penny girl.
Come on then.
Have you had it on the scales?
Not yet,
Just
no.
pop it on, let's just. So, so obviously Penny was really poorly when we first saw her a couple of weeks ago with that really horrible high temperature, and then she had her vomiting and diarrhoea and joint pains as well.
Yeah.
Have you had any of those symptoms returned?
No, nothing.
Because that temperature was sky high, wasn't it? It was,
but with the medications, everything just slowly went back to normal. Well, quite quickly actually.
Yeah, and I think that one of the, well, as we said at the time, I think one of the worries with the puppy is that they go from being quite bright to really quite weak very quickly, which is why the aggressive sort of fluid therapy and everything was good on there. She's just 4 months old now, I think, isn't she? Is she 4 months? Yeah.
4 months.
I'm going to say she's going to be a big girl as well, I think.
Yeah.
Sorry, Penny, this is the bit you probably don't like.
Oops.
And you've not had any sign of any funny loose motions or?
No, everything's been brilliant. Back on a normal
she's
food.
Eating like a horse, yeah. Yeah, probably the next couple of months you'll get quite a lot of. See you can see there the adult teeth and the baby teeth. There's a mixture of.
I've got 4 deciduous teeth that have been spat out, quite big ones.
Well, the canines are due to come out any time. They're the big ones that the corner incisors through, but not the corner incisor there.
Yeah.
The main canine is the one behind it, and that'll come through. That'll be a big tooth. She's had a bit of nail polish on as well.
Well, yeah, I tried to get it off before I came, but she didn't want. She didn't want me to take it off.
Very smart. Let me go and get her injection.
Penny is a blue Harlequin Great Dane, and I only got her 3 weeks ago. And then she became ill after her first vaccination. In the first week I had her, so it was quite upsetting, really, and sad. But I think it's brought a bond together. We've bonded quite well. She's really close to me already. At home I have 2 Bengal cats, and she just wants to play with them all the time, but they're not so keen at the moment.
So after this jab, she's fully protected in 10 to 14 days time. Let's see if you're going to be a brave girl. There we go. What a good girl.
Didn't even feel
She's
it.
good, wasn't she? Yeah, that was good, wasn't it? And I say we'll probably do the other one in a week's time. I'm really pleased she's doing well.
Me too.
Yeah, well, it's been a worrying time for you.
Yeah,
but,
well, you were great, and you gave me all the support I needed. And, you know, I was really, at the time, I suppose I didn't show my appreciation, but I was really upset. So.
Yeah, and puppies are our babies, aren't they?
Yeah.
Quite right as
Big
well.
baby.
Yeah, no, but it's amazing how quickly they get under your skin, don't they? And you know, but I'm sure she'll do good. And I say definitely, if there's any relapses, we've got to be onto it straight away. So it's really important.
Great.
Get the last bit done. Oh,
thank you so much.
Bringing her down, that's lovely. Thanks very much.
Thank you.
Jennifer has brought her own pet Diamond, a West Highland Terrier, in to be examined before her operation tomorrow.
She suffers from a condition called dry eye, where she has to have ointment in, and I don't know if that's the cause or whether it's just coincidental, but she's got like a wart on her eyelid which is causing her a lot of discomfort. So she's in tomorrow to have that removed, and while she's here she's going to have her teeth cleaned.
So the very important thing with her, she's a special need from an anaesthetic point of view. So we've run a blood profile to check the kidneys and liver and everything. They're all doing pretty well.
For this thing, it is nice to have that personal side and know that everybody is competent at their job and are going to do the best for her, and feel quite comfortable coming in to have it done.
Good.
Looking forward to this time tomorrow and everything's all done.
We'll get lots of thank you cards and quite close relationship with obviously clients that come regularly with an ill dog or an ill cat.
Ruby and Benson's owners have arrived to pick them up after their day at the vets.
Ruby's absolutely fine. Anaesthetic-wise, she's been absolutely fine.
Hello, Ruby. Hello, sweet. Come on, Ruby. Let's go.
So this basically runs through everything for you with him for tonight. So just saying, obviously he's had the general anaesthetic, he's had his remaining teeth descaled and polished, and he's had 3 taken out.
Lovely, thanks for your
Thanks,
help.
I'll see you in 2 days.
No problem.
Yeah.
It's the end of a busy day at Plains Road Surgery. That's a day in the life of Nottingham's Oak House Veterinary Centre.
I've been kind of working long enough to have done puppies' first vaccinations and then see them at the end of the days. And I think there's a great feeling of, you know, it's kind of part of your cycle of the life of that pet.